Welcome to Mindful Objective, the podcast where we uncover the root causes of common health struggles and guide you through to holistic ways to restore balance. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. In this episode, we'll be discussing estrogen dominance. It's a term many have heard, but truly few understand it. This hormone imbalance isn't just too much estrogen, it's about imbalances relative to progesterone, and it can affect both men and women. From mood swings to heavy periods to stubborn belly fat, estrogen dominance hides in plain sight. As a reminder, this podcast for educational purposes only. We do not diagnose, treat, or cure any illness or disease. So let's get into it. Estrogen dominance is a term that gets thrown around quite often, but most people don't fully understand what it even means. Contrary to what the phrase might suggest, estrogen dominance isn't always about excessively high estrogen. Instead, it's about an imbalance between estrogen and progesterone. You can have normal estrogen levels and still experience estrogen dominance if your progesterone is too low to keep that estrogen in check. So let's break it down even further. In the healthy hormonal state, estrogen and progesterone work together to regulate your menstrual cycle, maintain mood, support fertility, and protect against conditions like breast cancer and uterine overgrowth. Estrogen is stimulating. It builds up in the uterine lining, promotes cell growth, and affects neurotransmitters like serotonin. Progesterone, on the other hand, is calming and balancing. It keeps the estrogen from becoming overwhelming. It helps prevent anxiety, supports deep sleep, and plays a vital role in metabolism and immune balance. So when progesterone drops, whether due to chronic stress, aging, overexercising, and poor ovulation, estrogen influence becomes unchecked. This creates a hormonal environment that favors estrogen dominance. There are three common patterns of estrogen dominance. This is what number one would be estrogen is high and progesterone is low. This is the classic presentation on most obvious lab tests. Number two would be estrogen's in the normal range, but progesterone is too low. Many women fall into this category and they're told their hormones are normal, even though their ratio is off. Number three would be estrogen is normal or low, but symptoms still point to dominance because estrogen isn't being properly detoxified or cleared from the body, so it builds up in the tissues. That third point is especially important, right? Estrogen is fat soluble and it gets stored in your fat tissue. It can also recirculate through a sluggish liver or constipated colon, creating symptoms that mimic high estrogen even when blood levels seem fine. So what causes estrogen dominance? Several lifestyle and environmental factors contribute to the imbalance. Chronic stress, cortisol, this is the primary stress hormone, competes with progesterone production. Over time, stress depletes progesterone, shifting the balance towards estrogen. Xenoestrogens, these are synthetic compounds found in plastics, fragrances, pesticides, and personal care products that mimic estrogen in the body. Poor liver detox, if your liver is overwhelmed by alcohol, sugar, medications, or even lack of nutrients, it can't properly break down and eliminate excess estrogen. Low fiber or high fat diets, this can lead to poor estrogen clearance and encourage reabsorption of estrogen in the gut. Excess body fat produces and stores estrogen. This fat you carry, especially around the abdomen and hips, more estrogen may be in circulation. For women, this is especially common in perimenopause, postpartum. Women on hormonal birth control may suppress natural progesterone production, but men can experience estrogen dominance too. In men, testosterone often converts to estrogen through a process called aromatization, especially if you're overweight or exposed to environmental estrogens. The result? Fat gain, mood swings, low libido, and even gynecomastia, which is chest fat development. So those on hormone replacement therapy, HRT, are not exempt from this issue. Many women take estrogen for menopause symptoms, but either do not get enough progesterone or don't metabolize estrogen properly. This creates a scenario where symptoms like breast tenderness, bloating, or moodiness persist, even when they're on the right path. If you've been dealing with hormonal symptoms, but you told your labs are normal, this could be a key piece of the puzzle. One of the most frustrating things about estrogen dominance is how easily it can be dismissed or misdiagnosed. The symptoms are often chalked up to, again, normal aging, mood disorders, even being just a woman. We hear this a lot in different health issues out there. But the reality is that these symptoms are signs that your body's out of balance and they deserve to be taken seriously. Let's begin with what symptoms are most common in women dealing with estrogen dominance. Some experience heavy and painful periods, severe PMS, breast tenderness or swelling, mood swings, anxiety, irritability, bloating, especially before their cycle, fat gain, especially around the hips and thighs, headaches or migraines, difficulty sleeping, brain fog, low libido, and others even have even more chronic outcomes: fibroids, endometriosis, ovarian cysts, infertility, fibrocystic breasts. Now consider this. Many of these symptoms are brushed off at just this is how your cycle is, or you're in perimenopause. And where hormone shifts during these stages are expected, intense disruptive symptoms are not normal. These are signs of imbalances. Let's take mood swings, for example. A woman may feel emotionally stable during part of her cycle, then become anxious, weepy, or angry in the days leading up to her period. That's often due to a rapid drop in progesterone and the presence of too much estrogen. This emotional swing becomes more severe over time. Or consider bloating or breast tenderness. These are signs that your estrogen is stimulating tissue too aggressively. If your body doesn't have enough progesterone to counteract the stimulation, symptoms will show up. Progesterone is anti-inflammatory. It calms the tissue growth estrogen promotes. When the balance tips, the body responds with inflammation, water retention, and even sensitivity. Now, what about men? Yes, men can absolutely experience symptoms of estrogen dominance, and they're often overlooked. For men, symptoms might include loss of muscle mass despite training, increased belly fat or love handles, emotional sensitivity or irritability, low libido or erectile challenges, fatigue or motivation, that gynecomastia, which is that male breast tissue growth. Many men are surprised to learn that testosterone can convert into estrogen via an enzyme called aromatase, especially in those with higher body fat percentages or metabolic issues. So if a man has low testosterone, it's worth checking if he also has relatively high estrogen. Even men on testosterone replacement therapy, TRT, are at risk of estrogen dominance. Without supporting estrogen clearance or monitoring conversion pathways, they can develop unwanted side effects despite optimized T levels. You're not just going based on one level. Now let's circle back to those on HRT, hormone replacement therapy for women. This is where things get a little more complicated. A woman in menopause might be prescribed estrogen, sometimes in an oral pill, a patch, or it could even be a cream, to manage hot flashes, night sweats, or other symptoms. But if progesterone isn't prescribed or it's underdosed, then estrogen dominance can still occur, even in a balanced regimen. But here's the kicker. Many providers don't test or monitor estrogen metabolism. You might be absorbing estrogen just fine, but if your body isn't clearing it out efficiently due to liver burden, poor methylation, or sluggish digestion, it still will build up in the system. Again, symptoms don't lie. Lab numbers can appear normal, but your experience tells the real story. Many of our clients come to us saying things like, "My doctor said everything looked fine, but I still feel awful. I'm on a hormone replacement therapy, but I'm bloated and irritable all the time. I've had heavy periods my whole life. Maybe it's just how my body is." These are all red flags that something deeper is going on. But here's the other trap. Medications like antidepressants, even anxiety meds, are often prescribed in response to hormone-driven mood issues without investigating the root cause. While medications can help manage symptoms, they do not solve the underlying hormone imbalance. And that imbalance, if left unchecked, can increase the risk of estrogen-sensitive cancers, insulin resistance, autoimmune flare-ups, gut issues, and this would be due to estrogen influence on bile and digestion. If you experience multiple symptoms or even mild ones, it's worth taking a closer look. Your body is communicating with you through these patterns. When you learn to listen, we can start correcting the imbalance at the root. In our practice, we often start by asking women and men to track their symptoms across a few weeks. We usually look for patterns, timing, and what triggers make things worse. Then we layer functional labs to pinpoint the underlying physiology. We're not just chasing symptoms. We're mapping out why this is happening and what your body's trying to say. Estrogen dominance isn't something you have to live with or just get used to it. It's real, measurable imbalance that can be addressed. Once we recognize the signs and take them seriously, now on to why we lab test. When it comes to hormone health, lab testing is not optional. It's essential. You can't effectively support or correct estrogen dominance if you don't know what's actually going on beneath the surface. Far too many people try to guess and check their way to hormone balance, often wasting time, money, and energy on protocols that never address the real issue. That's where functional lab testing comes in. It doesn't just tell your hormone levels, it helps us understand how your body's metabolizing, eliminating, and reacting to those hormones. So let's start with the basics. In Mindful Objective, we use several types of functional lab tests, but this depends on the individual symptoms, age, and whether they're on or off hormone replacement therapy. Here's the primary tools we use. The Dutch test, which is a dry urine test for comprehensive hormones. This is one of the most powerful comprehensive tests. The Dutch test gives us a detailed breakdown of estrogen levels, E1, E2, E3, progesterone metabolites, testosterone and its metabolites, DHEA and other androgen precursors, cortisol patterns, not just total levels, but timing and rhythm, estrogen metabolism pathways. This is critical for estrogen dominance. So why is the last so important? Your body breaks down estrogen in three primary pathways. There's 2O pathway. This is protective. This is the preferred pathway. It's anti-protective, meaning that it's less likely to stimulate tissue growth or trigger inflammation. This is potentially harmful. This can create reactive metabolites that, if not detoxed further, may damage DNA and increase risk for estrogen-sensitive conditions. 16O, aggressive but common. This pathway can fuel symptoms like bloating, breast tenderness, and fibroid growth. Most conventional providers never check this. You could be taking estrogen or replacement hormones, and your symptoms could persist because you're pushing it down the wrong detox channel. We've seen women with perfect estrogen levels, but 90% of them are going down the wrong pathway. This recipe for estrogen dominance is a long-term risk. Another test we do is saliva hormone panels. These are great for capturing hormone rhythm, especially cortisol. When paired with estradiol and progesterone levels, this can reveal how stress is influencing your estrogen-progesterone balance. Common pattern we see is cortisol is low in the morning and high at night. Progesterone is depleted. Estrogen is slightly elevated or unopposed. So this will reflect the hormone chaos, right, that chronic stress creates. If your cortisol rhythm's off, your adrenal glands can't produce the raw materials, pregnenolone, that your body uses to make progesterone. This creates a downward spiral where estrogen dominance will take hold. And another one that's our most common is blood panels. While not as detailed as saliva testing, blood labs still offer valuable insight, especially on those that are on TRT or HRT. We often check the estradiol, E2, total estrogen when available, progesterone, free and total testosterone, SHBG, sex hormone binding globulin, FSH, LH, DHEA, vitamin D, B12, folate, zinc. These are nutrients that influence hormone production and detox. We'll also look at liver enzymes and inflammatory markers because they tell us if your body's producing hormones well or under pressure. And while blood gives us a snapshot, it's best to use in context with symptoms tracking and functional testing to get a full picture. Another one would be is gut and detox labs. Estrogen, again, doesn't work in isolation. It relies on your gut, liver, kidneys to break down and be excreted. That's why we often recommend tests like the organic acid test alongside hormone testing. Organic acid test can reveal a bacterial overgrowth or dysbiosis that interferes with estrogen detox, mitochondrial function, and oxidative stress. B vitamin and methylation markers, these are essential for liver detox. If your gut isn't healthy, estrogen recirculates. That's how someone with normal production can still have dominant symptoms. The body can't eliminate it properly at that point. So here's why functional testing is non-negotiable. One-size-fits-all protocols do not work. You need to know, are you low on progesterone? Are you overproducing estrogen? Are you pushing estrogen down the wrong detox pathway? Are your stress hormones driving the imbalance? Are you even absorbing your hormone therapy if you're on it? We don't believe protocols for estrogen dominance. We believe in people's specific strategies. Testing tells us how to personalize your care. Again, it's everything specific to an individual. So your body will not react the same as your neighbor's body or your sister or family member's body. Everybody reacts different. You could do hormone replacement therapy or you could be doing everything natural. And for some, they absorb the nutrients quickly and it helps balance their estrogen and progesterone while you do it or do, hormone replacement therapy, TRT, and you increase testosterone, whatever you're taking. And next thing you know, your estrogen's out of whack and you're not understanding why. And it just leads down a rabbit hole. Then you start feeling worse when the whole reason you got on things or started taking supplements was to feel better. But something, that's why we have to test and individualize those protocols. It also helps us track your progress. You may feel better after 30, 60 days on a protocol, but rechecking your hormones lets us adjust intelligently and safely. At Mindful Objective, we walk you through the results line by line, translating complex data into plain language. Then we help you implement practical supportive steps based on those findings. Again, you're not guessing anymore at that point. You're working with real data, and that's where healing begins. Now let's talk about natural ways to support estrogen balance. When it comes to supporting estrogen balance, especially for those experiencing estrogen dominance, many people think immediately of supplements or hormone therapy. While those tools are helpful, they're not the starting point. The most powerful and sustainable approaches rebalancing estrogen involves in your everyday lifestyle choices that support body's ability to produce, metabolize, and eliminate hormones efficiently. This is true whether you're navigating perimenopause, recovering from birth control, dealing with monthly PMS, or even currently using hormone replacement therapy. In fact, those on HRT need the support just as much, if not more. Your body still has to process and eliminate that estrogen efficiently. Let's walk through the foundational ways we help our clients at Mindful Objective support healthy estrogen balance. Initial one we always do is nutritional strategies that actually work. Food is your first line hormone defense. The right nutrients can make all the difference on how your body detoxes excess of estrogen and processes enough progesterone. Start increasing by eating cruciferous vegetables, broccoli, cauliflower, kale, arugula, Brussels sprouts. These help support liver phase 2 detoxification and production of DIM. This is a compound that helps move estrogen down the clean 2O pathways. Fiber. You want to aim for 25 to 35 grams of fiber a day through vegetables, seeds like flax or chia, legumes or whole grains. Fiber binds excess estrogen in the digestive tract and helps eliminate it through the stool. Healthy fats, omega-3s from wild fish, flaxseed, walnuts produce inflammation and support progesterone production. Liver-loving foods, garlic, onions, beets, artichokes, all provide sulfur compounds and antioxidants to boost liver detox. And just as important, cut down on making things worse. Limit alcohol, ultra-processed foods, sugars, inflammatory oils like soybean or canola. These all stress the liver, increase insulin resistance, and worsen hormonal symptoms. Now on supplement support. Once foundational nutrition is in place, the food, supplements can be used to accelerate progress. We don't believe in a one-size-fits-all regimen, right? But there are certain tools we often recommend based on lab testing. DIM, this is the most common. It's found naturally in cruciferous vegetables. This supplement supports the conversion of estrogen into less aggressive metabolites, but used short-term under guidance, should not be used long-term. Calcium D-glucarate, this helps with estrogen clearance by inhibiting beta-glucosinase. This helps with estrogen clearance by inhibiting certain enzymes that help cause estrogen to be reabsorbed in the gut. Magnesium glycinate or citrate, especially for hormone detox, bowel regularity, and to help you calm your nervous system. Vitamin B6 and B12, these are key cofactors of methylation. This process which your liver detoxifies estrogen. Low B6 levels are associated with more severe PMS symptoms. Liver support herbs, milk thistle, dandelion root, burdock root, and artichoke extract can gently enhance detox pathways. These supplements are especially important for those on HRT because external estrogen still relies on your liver and gut to process and eliminate it. If those pathways are blocked, side effects like bloating, headaches, or breast tenderness can persist, even with bioidentical therapy. We offer all these professional-grade formulas through our online dispensary at 20% off retail pricing. Every product is curated for quality, purity, and clinical effectiveness. So feel free to check it out on the website, mindfulobjective.com. Now, the next thing you want to do, you're eating right, taking the right supplements. Now you need to reduce environmental estrogen exposure. We're constantly exposed to xenoestrogens, right? Chemicals that mimic estrogen in the body. They're found in plastic containers and food wraps, pesticides and herbicides, fragrance, personal care products, non-stick cookware, canned foods with BPA lining, air fresheners and cleaning sprays. To reduce your overall toxic load, switch to glass or stainless steel food storage. Use unscented or naturally scented personal care items. Choose organic produce when possible, especially the dirty dozen foods. Ditch synthetic air fresheners and use essential oils and natural options. Filter your water. Municipal water often contains hormone-disrupting chemicals, right? How many of people are drinking a lot of fluoride? These small steps add up. You do not have to do it all at once, but removing just a few major sources of exposure can relieve the burden on your endocrine system. Now, another one that's often common too is managing stress. Chronic stress is one of the biggest root causes of estrogen dominance because it depletes progesterone. Your body prioritizes making cortisol, the primary stress hormone, over making sex hormones. That means less progesterone to balance out that estrogen. Here are simple strategies to support hormone balance through stress regulation. Deep breathing. Try that 4, 7, 8 breathing or box breathing throughout the day. Walking outdoors, especially helpful in the morning. Herbs like ashwagandha, rhodiola, or holy basil can support stress response over time. Sleep hygiene. Go to bed at 10:30. Reduce screen time in the evening. Journaling or gratitude work. This helps shift your nervous system out of that fight or flight. If you're always on the go and never giving your body a chance to recover, that's like all of us. Hormone repair won't happen, no matter how many supplements you take. Again, it's all about rest, right? Take care of yourself. Specific tips for those on hormone replacement therapy, testosterone replacement therapy. These lifestyle strategies can absolutely be essential. You're not off the hook just because you're taking hormones. Important things to consider. Are you on progesterone to balance your estrogen? Are you detoxing estrogen properly through liver and gut pathways? Is your dosing and delivery method optimized for absorption and clearance? How many people get tested for that? When do you go to your practitioner and they talk about your gut and liver pathways while you're on HRT, TRT? Rarely. HRT without proper support can worsen estrogen dominance instead of resolving it. We see this in the forums all the time. So at Mindful Objective, we help clients on HRT fine-tune their protocol with labs and supportive tools. This way they can feel the benefits without the side effects. Estrogen balance is about more than numbers. It's about how you support your body to handle hormones every single day. Nutrition, detox, stress, and environment all play a critical role. When you start focused on these foundations, your body begins to shift naturally into a more balanced and resilient state. Now let's talk about our approach and what we actually offer. So at Mindful Objective, we take a completely different approach to estrogen dominance than what you find in most conventional settings. Instead of masking symptoms with prescriptions or treating every client the same cookie cutter protocol, we focus on identifying and addressing the root cause based on your unique biology, your lifestyle, and your goals. The key word there is you as an individual, not the whole masses, but you specifically based on your labs and based on your symptoms. That means we don't guess, we test, we listen, and we tailor the plan that actually works for your life. So let's walk you through what we do and how we support the struggling estrogen dominance, whether you're experiencing naturally due to stress or environmental exposures or using hormone replacement therapy. So initially, functional lab testing, everything starts with data. We don't rely on vague symptoms alone, right? Your symptoms could overlap with many other conditions. We combine your lived experience with comprehensive testing to uncover exactly where your hormones stand and, more importantly, where they're out of balance. One of the most common tests, as we talked about, is that Dutch test. This way we could see your testosterone, progesterone, DHEA, cortisol throughout the day, your estrogen. It also shows how your body's metabolizing estrogen through different pathways. This is critical for identifying hidden estrogen dominance. The hormone and adrenal saliva panel, right? This is useful to understand your cortisol patterns, your sex hormone output, especially cycling in women or those not yet on TRT or HRT. The common one we often do, usually and with every client, is blood work. We offer both foundational hormone panels and advanced nutrient testing through discounted lab packages. You can test your estradiol, progesterone, SHBG, testosterone, DHEA, vitamin D, and more. The next one would be that gut testing. Another one would be organic acid test or a stool test to explore your gut bacteria in your stomach and your nutrients. We often offer the organic acid test or GI test, which is a stool test, and this way we can identify different gut issues, detox challenges that may be impacting estrogen balance. We guide you with the right test for the symptoms and situation. No upsells, no unnecessary panels. And step 2 would be one-on-one consults with a real strategy. After your labs come in, you don't get handed a generic protocol. Instead, you get one-on-one consultation where we walk you through the test results in plain English. Connect your symptoms with your biology. Discuss your current diet, lifestyle, and any supplements or medications you're using. Create a step-by-step support plan that's customized, that's realistic, and it's evidence-informed. You're not rushed. You're not just another patient file. You're an individual. And our job is to help you understand your body better and make informed choices moving forward. For clients on HRT, TRT, we offer continued monitoring to fine-tune your dosing to ensure your detox pathways are keeping up. For those who prefer a natural approach, we use nutrition, lifestyle interventions, and targeted supplementation to help restore balance. Then another one would be supplement protocols built on labs, not based on trends. Not something you saw on TikTok, but it's something we saw in your lab. We offer access to over 300 top-tier practitioner-only brands in our supplement store. Every client receives 20% off retail pricing, often lower than Amazon for trusted third-party products. One thing to note on a lot of Amazon products, we're hearing there's a lot of knockoffs out there. For example, Now brand. We see a lot of Now brand. You could go to the Now's website and see the actual retail price. And then you could go to Amazon and see the price. Normal product that's $80 or $50 is selling on Amazon for $12. Be skeptical, because we found out a lot of those are knockoff products from China. They're not actually Now brand. They're just labeled to look like Now, and we have no idea what's in them. Here's the difference. You don't get a bundle. You get products selected specifically for your lab results and your symptoms. We never recommend more than you actually need. Everything's professional grade with full transparency on dosing, ingredients, and manufacturing. Some examples of what we may use for estrogen dominance include DIM for estrogen metabolism, that calcium glucaronate for phase 2 liver detoxification, or you may do a functional medicine detox, bioidentical progesterone, magnesium, B6, and zinc for stress resilience and hormone support, D3 with that too, gut binding agents to help with estrogen reabsorption. We do not provide recommendations based on guessing. Recommendations are based on your symptoms and your labs. We're making evidence-based decisions based on your test results and how your body responds. The next one would be ongoing education community. That's the reason we're doing these podcasts. We're not just here to tell you what to do. We want you to understand why you're doing it. Through our podcasts, educational videos, and private client resources, we break down complicated health topics like estrogen metabolism, detox support, how to interpret hormone labs, what symptoms actually mean. You don't need a medical degree to understand your hormones. You just need someone to walk you through it. We also provide templates for food and symptom tracking, client-only videos on lab interpretations, quarterly QA sessions on trending health topics, email support between sessions for ongoing questions. You're never left on your own. You have a partner in the healing process. How do you get started? If you suspect you're dealing with estrogen dominance or you're on HRT, TRT, but not feeling good as you expected, here's what we recommend. Start with the foundational lab. Our hormone harmony panel combines blood and dried urine or saliva testing for a full picture of hormone balance. Step 2 would be book a consultation. After your results come in, we usually schedule a 45 minutes to an hour virtual consult to walk you through the findings and co-create your support plan. Step 3 would be we'd implement that protocol. You receive a written plan with nutrition, lifestyle, and supplement guidance. We also offer lab retesting windows to measure progress. And the last step would be adjust as needed. We're not rigid. We work with your body's feedback. If something needs to be shifted, we adjust together. We understand, now do you have new symptoms? Are your symptoms going away but not fully? Okay, let's discuss it. Let's see how you're eating. Let's see what you're drinking. And let's see what you're taking. And let's adjust from there. This is what it means to take a root cause integrative approach. Whether you're on the bioidentical hormones or trying to support your body naturally, you deserve clarity, guidance, and tools that actually work. Estrogen dominance isn't just a diagnosis from a medical doctor. It's a signal that your body needs better support. And Mindful Objective, we help you listen to those signals and respond to what creates a lasting change. Now to wrap things up, just one thing to note is that Mindful Objective, we help you listen to those signals and respond to a way that creates lasting change. All right, we want to get you healthy. We want to make you feel good. Not just okay, but excellent, great. Thanks for tuning in to Mindful Objective. Estrogen dominance doesn't have to rule your life. So whether you're cycling, perimenopause, menopause, or on HRT, TRT, there are powerful tools available to support true hormone balance naturally and intelligently. If this episode resonated with you, visit the website to explore more testing options, book a consultation, or shop curated protocols, and be sure to share with others. Reminders, information provided in this podcast for educational purposes only. It's not intended to replace medical care, diagnose any condition, or serve as an individualized health advice. Always consult your licensed healthcare provider before making any healthcare decisions. So see you next time. Stay curious about your health. Stay well.